Hello guys, this is me Dr.Kashan Qasit. Today here we were discussing the ECG patterns. In previous lecture we have discussed another part of the ECG pattern. Today we are going to discuss another important topic, which is hypertension. So let's define this topic of hypertension. So basically hypertension is defined as when the blood pressure is greater than or equal to 140 by 90 millimeter of mercury. So this 140 by 90 means the systolic blood pressure is greater than or equal to 140 and the diastolic equivalent to 90. So this is the basic definition of essential hypertension. So there are reasons or the causes for the hypertension. We will divide this into two. Number one, which is essential hypertension, which is usually occurring in 95% of the patients, and the etiology of this essential hypertension is multifactorial, and the etiology involves the genetic causes and environmental factors. So this 95% of the patients which are having essential hypertension, still the etiology, exact specific etiology is not known. So these are the reasons or factors for essential hypertensions. The secondary hypertension, which is usually occurring in 5% of the patient, has a lot of the causes, and these are several causes which we can remember by mnemonic we called recent, or which is showing the renal cause for secondary hypertension, and it involves, for example, stenosis of the artery which is supplying the blood to the kidney. So the renal stenosis can also be the cause, and glomerulonephritis, for example, can also be the cause for secondary hypertension. Likewise, in the endocrine, the conditions like Cushing syndrome, hyperthyroidism, and Cohen syndrome, all these will lead to secondary hypertension. Then the C, which is showing the coarctation of aorta, and this coarctation of aorta is also the secondary cause for hypertension. Likewise, estrogen, for example, the patient is using oral contraceptive, this can also lead to secondary hypertension. Likewise, there is a neurological cause like increase in the intracranial pressure or psychostimulant agents, these are also leading to secondary hypertension. So all these are the causes for secondary hypertension. Last one here is the treatment. T is showing the treatment. So basically this recent is the mnemonic, and this is showing the major causes for secondary hypertension. So this treatment involves the patient who are taking the drugs like NSAIDs and glucocorticoids. So these are the two I have mentioned the examples. There are other drugs as well which are showing the T of the recent, and this is showing the cause for secondary hypertension. So until now we have discussed the causes for hypertension. Now moving towards the diagnosis of hypertension. Whenever there is a rise in the blood pressure, how will you diagnose this patient is having stage 1, stage 2 or stage 3 hypertension, or either he is having malignant hypertension? So to confirm the diagnosis of hypertension in a patient with a clinical blood pressure if greater than 140 by 90, if the clinical blood pressure is greater than 140 by 90 and ambulatory blood pressure which is greater than 135 by 85, then you can confirm the diagnosis of hypertension. You can also use despite of this one, ambulatory blood pressure measurement. If there is a, you can say the patient is not tolerating, then you can use the home blood pressure measurement method. So you can also use ABMP or HBMP method. So if the values are greater than this one, then you will confirm the diagnosis of hypertension. Now I am going to discuss some important points regarding the measurement of blood pressure in the clinic and the key important points during measurement. Number one here is the measuring blood pressure. During measuring the blood pressure, number one here is check the pulse regularity. Now always palpate the radial pulse before going to measure the blood pressure, because pulse regularity is very important. If the pulse is irregular, like in case of atrial fibrillation, then the automated machines which we have in the hospitals and in the clinic setup, that cannot measure the BP exactly. So you will go for manual blood pressure measurement, and you will go for the auscultatory method through the brachial pulse. So checking the pulse regularity is very important. Now the second one here is measuring blood pressure in both arms, because if the blood pressure measurement in the right arm having the blood pressure measurement, for example 130/80, and right one is having the 145/80, then there is a difference in both the arms. And if there is a difference, then there is a reason for that. So always look for the cause for difference in the blood pressure. First of all, you will measure the blood pressure. If the difference between the blood pressure in both the arms, the difference is if greater than 15, repeat the blood pressure. Then repeat the blood pressure. If the blood pressure again having the difference of 15 millimeter of mercury, then you will look at the cause of the difference in the blood pressure. And if the difference again is greater than 15 millimeter of mercury, then you will record the BP of higher blood pressure. The arm which is having the higher blood pressure should be recorded. The second thing here is you will look for the cause for the difference in both the arms. Like for example, in supravalvular aortic stenosis, there is a difference in the both arms blood pressure. So always look for the cause of the difference in both arms. Now moving next towards the BP measurement in the clinic. If you are going to measure the blood pressure in the clinic and if it is greater than 140/90, then repeat the BP during the consultation. This is the second value. And if the second value different from the first one, then you will go for the third value. So we have now three values of the BP, and you will select the BP of the last two values which you have taken. The last two values, the lower BP of the last two values will be recorded as your clinical BP. So this is very important point regarding the blood pressure measurement in the clinic or in the hospital setup. Now if the clinical BP is between 140/90 and 180/120, between these two, you will offer the ambulatory blood pressure measurement. So if the patient is not tolerating this method, which is ambulatory blood pressure measurement, you can also recommend home blood pressure measurement method. So these are the important points regarding the blood pressure measurement. Now we will discuss the ambulatory blood pressure measurement method and the home blood pressure measurement method. So now we are going to discuss the difference between ABMP and HBMP. So basically the ABMP, which is ambulatory blood pressure measurement, is helping in diagnosing sometimes in patient which is having the white coat syndrome. The BP climbs greater than 20 millimeter of mercury whenever they enters the clinic. So in order to prevent the diagnosis of white coat syndrome, you have to go for ambulatory blood pressure measurement. So in this ambulatory blood pressure measurement, you will look for the two measurements taken during the wake up hours of a patient. Two measurements are taken, and usually the hours are between these values, which is 8 to 22. So the average of 14 values, you will take the 14 values. The average of 14 will be taken as your mark for average blood pressure measurement of ambulatory blood pressure measurement method. And this method, if not tolerated by the patient, you will go for home blood pressure measurement method. So the two consecutive measurements are taken 1 minute apart. This can be taken twice daily, like one in the morning and one in the evening. So this should be taken for 4 days or ideally 7 days. So the average taken should be of 7 days, discarding the first day value. So you will discard the first day value measurements in the home blood pressure measurement method. So these were the method for the measurement of blood pressure. Now I'm going to discuss here the stages of hypertension. There are 3 stages of hypertension. Number 1 stage here is showing when the blood pressure of a patient is greater than equal to 140/90, and the average of these either ABMP or HBMP greater than 135/85 means the patient is having stage 1 hypertension. Now coming to the stage 2, this is having the value 160/100 and ABMP, HBMP value 150/95. So this patient is having stage 2 hypertension. Now moving towards the stage 3, which is the last stage of hypertension. If the systolic blood pressure is greater than 180, and the clinical diastolic blood pressure greater than 120 millimeter of mercury, then you will say the patient is having the stage 3 hypertension. So these are the stages for hypertension. Now we will discuss here the management of hypertension. So first we will discuss the lifestyle modification, then we will discuss the pharmacological management method for controlling the blood pressure. So this was all about today. In the next video we will be discussing the management. Hope you like my video. Thank you very much for watching. I'll see you in my next video.